There are more than 18 million Americans over the age of 65. Most of them have low income. Most of them are threatened by illness and medical expenses that they cannot afford. And through this new law, Mr. President, every citizen will be able, in his productive years when he's earning, to insure himself against the ravages of illness in his old age. This insurance will help pay for care in hospitals, in skilled nursing homes, or in the home.
That was President Lyndon B. Johnson speaking at the signing ceremony of the law that would become the modern-day Medicaid and Medicare programs. Tomorrow marks the 60th anniversary of that signing, as the future of the two landmark health care programs is in question. Our next guest says the cuts in President Trump's so-called One Big Beautiful Bill that target Medicaid will actually impact Medicare as well. And joining us now, retired scholar at the American Enterprise Institute, Norm Ornstein. He is the co-author of the book titled Intensive Care: How Congress Shapes Health Policy. Norm, thank you for being here.
Sure.
So talk to us, give us your assessment here as to the impact of this piece of legislation.
You know, let's start, John, with the reality that we had a hellscape in America before 1965 for senior citizens and for poor people, and it's been transformative. We've seen all of this attention on the Medicaid cuts in the so-called One Big Beautiful Bill. But what's gone largely unnoticed is that because this bill adds trillions to the deficit, we've had a provision in the law called PAYGO, pay-as-you-go budgeting. And that means automatic cuts in a number of other programs because we're going deeper into debt. $533 billion scheduled to be cut from Medicare over the next decade, 4% a year, and it's going to create real problems, and not just for seniors, because we have a lot of other people who are affected by Medicare, and of course it's interrelated with the whole healthcare system. So with the changes in the Affordable Care Act, the changes in Medicaid, we're seeing from hospitals to doctors to the entire infrastructure of the healthcare system is under siege.
So tell us some of the real world impacts here. Who are some of the people across this country? And let's be clear, many of these people voted for President Trump. How will their lives change?
You know, what's so interesting about this and tragic in many ways is that the people who will be most affected are the Trump voters. It's rural voters, it's poorer white voters, it's people in small towns that don't have as much of an infrastructure in the healthcare system. We've already seen stresses in hospitals. And one thing that's also important to remember is that it's not just the hospitals that are going to go under or dramatically cut their services. That will put enormous strains on every other hospital. And that means that we're going to see stresses in the system. We're going to see, if you're going to an emergency room, no matter where you are, you might have a wait that's much, much longer. We know that some doctors, if the rates get cut, are going to say, we're not going to take Medicare anymore. And that means people are going to have to find other providers. And when you add to that, we have a lot of dual eligibles, people who are on both Medicare and Medicaid, poor people. The nursing home program, which is the largest share of Medicaid, we're already seeing nursing homes under stress and closing. You know, before we had Medicare and Medicaid, seniors who were unable to care for themselves were either out on the street or having to live with their families. Now, because of Medicaid and its interaction with Medicare, they can go into nursing homes. We're going to see problems all throughout the system that we haven't had nearly as much of in the last 60 years.
Norm, is there any way to counteract this other than restoring the money? I mean, are there any efficiencies, any changes in the system? I know you're an expert that perhaps could ameliorate.
So we might well see. Remember that in the One Big Beautiful Bill, they put off the Medicaid cuts until after the midterm elections.
Yeah.
The Medicare cuts are supposed to take place earlier. And we've seen in the past when this was supposed to happen that Congress passed a bill saying, no, we're not going to make those cuts. That may happen again, although you have a lot of Republicans who've been eager to take on these programs. If they don't make these changes, you know, we'll see some ability. I'm sure everybody in the healthcare system, all the practitioners, don't want to have a falter. They'll try and find ways. But you start to take money out of a system that's already under stress. And again, it's like the parts of your body, the organs are not separate. If one starts to fail, others begin to fail. With the changes that we know are going to take place in Medicaid and in the Affordable Care Act, people losing their insurance, we're going to see a ripple effect throughout the system. This is not going to be solved by efficiencies or by the unreality that so many people are leeching off the system, not working to get the benefits. That's just plain false. Yeah. It's not going to happen.
An important conversation, one we're going to continue to have. Retired scholar at the American Enterprise Institute, Norm Ornstein. Norm, thank you for being with us. You can read his latest piece for the New Republic. It's online now.